So for an IM injection, I'm going to make sure that I first check my doctor's order. My doctor has ordered 0.4 milliliters of sterile water given IM to my patient. And then I'm going to check my report to see if my patient has any allergies. They have no known allergies, so we're good to go. From there, I'm going to go ahead and gather all my supplies, keeping in my 6 rights, so right patient, right dose, right drug, right time, right route, and right documentation. From there, today I'm going to be using a 3 ml syringe. I went ahead and grabbed an extra needle. The needle gauges for an IM injection are 19, 20, 21, and 22, and then the lengths are 1 inch, 1.5 inches, and then 2 inches. Then I'm going to go grab my medication, keeping in mind I need to check it 3 times. Once when I grab it out of the Pyxis, second while I'm drawing it up, and third right before I give it to the patient. So I went ahead and grabbed sterile water out of the Pyxis. This is sterile water. It's in date, so we're good to go. And that's the first time I'm going to check that medication. I'm going to wash my hands, grab an alcohol prep. So from there, I'm going to go ahead and clean off the top of my vial with my alcohol prep. So while that's drying, I'm going to put the alcohol prep aside and then draw up 0.4 milliliters of air into my syringe. So since my vial is dry, I'm going to go ahead and inject my air into my vial and then draw up 0.4 milliliters of sterile water. So this is going to be the second time I'm checking my medication. I'm going to go ahead and recap that needle since I'm going to be using a different needle. Put that directly into the sharps. I'm going to then use my new needle, and this is ready to go give to the patient. So I'm going to knock on my patient's door. I'm going to ask them their name and their birthday while I'm looking at their name band, and then I'm going to ask them if they have any allergies. So I'm going to then tell them about what I'm going to be doing to them today. So their doctor ordered sterile water to be given in an injection, and they're okay with that. So I'm going to go ahead and wash my hands and put on my gloves. I'm going to ask them where they prefer their IM injection, which can be either in the deltoid or in the vastus lateralis, the dorsogluteal, or the ventrogluteal. So ventrogluteal is going to be on your hip pretty much. Your vastus lateralis is on the outer part of your thigh. For a dorsogluteal, we're going to be using 4 quadrants of one butt cheek, and it's going to be the upper outer corner where I'm going to be giving the injection. And then for the deltoid, I want to go ahead and find that shoulder bone, and then it's going to be about a 3-finger length down. So today he wants it in his deltoid, so I'm going to go ahead and use my alcohol prep and clean off my patient's injection site. Okay. So while he is drying, I'm going to go ahead and check. This is 0.4 milliliters of sterile water. That's my 3rd time. We're good to go. So for an IM injection, I'm going to take that off, put that out of the way, and then I'm going to spread the area apart so it's easier to get down into the muscle. So using a dart-like motion in a 90-degree angle, I'm going to go ahead and warn my patient, 1, 2, 3, stick, and go ahead and give that patient his injection. This goes immediately into my sharps container, and then I'm going to grab my gauze, hold pressure, and wash my hands, document how well the patient took the procedure, that I went and checked on them afterwards, where the injection was given, and all of that fun stuff.